Honoring Black History is brought to you by the Tennessee Education Lottery.
As we honor Black History, we take a look at a group looking to help the mental health of African Americans in Appalachia.
News Channel 11's Jayana Scurry takes a look at a study from an ETSU group that hopes to share their data with healthcare providers in the region to better understand the challenges the group may face.
Sarah Muhammad, East Tennessee State University sophomore majoring in psychology, has a passion for mental health. She decided to enter into the ETSU Elevates program with the topic of Black mental health care access. She won the pitch competition, winning a total of $6,000 to conduct a study on Black mental health care in Washington County, Tennessee.
After facing some interesting times with my own mental health during high school, mental health became something that I was really passionate about, and I just became very curious, right? How does the Black community in Washington County feel about their mental health, and are they getting the care that they need to address it if it's poor?
Muhammad partnered with the Northeast Tennessee Association of Black Social Workers to help with the study. Corey Whitfield, former president and current member of the group, says this study helps normalize the conversation of mental health within the Black community.
We in the African American community, we are a strong and we are a resilient group. And as long as we have church and God and family, that we can overcome. And these things are true. But being resilient and being strong in all of these things does not also mean that it does not mean that those things don't come with trouble. And it should be okay for us to be able to say, in spite of the fact that all of these things are surrounding me in my community, I don't feel okay today.
Muhammad says they plan to do outreach into the rural parts of Washington County as well.
Such as Fall Branch, right? And that's where the data I think will really speak, is not just for Johnson City, but for those who may have less access to resources than those who live in the city. I think Appalachia can be a picture of what's happening in the rest of the country as well. So not having access to those things that shape your mental well-being is life-changing, right? Life-changing for the worse. So if we can intervene in those disparities and find out why, then it just creates a better quality of life for the people in the region.
The data from the study will be shared with healthcare providers in the area,
so that patients who come in looking for mental health who are African American can receive the best care possible, so that providers understand what these patients are going through and the concerns that they might have, so that they can address that with dignity and care.
It will let clinicians and practitioners in our environment and in our community know that we need to be a little bit more culturally competent with how we address the African American community when it comes to mental health, because that will make them feel a little bit more comfortable with seeking those services.
Muhammad plans to keep the study open from February to early April. In Johnson City, Jayana Scurry, News Channel 11.